Hello, so the drug we will be discussing today is digoxin, and digoxin is usually given to someone if they're experiencing heart failure, atrial fibrillation, or cardiogenic shock. It works by inhibiting the sodium-potassium pump, which then results in a lot of sodium remaining inside the cell. And then another electrolyte comes and removes some of that excess sodium, leaving room for calcium to then enter the cell, resulting in heart muscle contractions, which is really important for someone who is experiencing heart failure and their heart isn't able to pump how it usually should. So some side effects that are expected is swelling of breast tissue in men, nausea, and sinus bradycardia. And then some unexpected side effects that you should report to your provider, doctor, involve weakness, any mood changes, any vision changes, and any tenderness in those breast tissues if you are a male.
When do you call a physician for digoxin? You call a physician whenever you hold the medication. And then for digoxin has sometimes it shows toxicity, which is seen through nausea, vomiting, and anorexia. So whenever you see all those signs and symptoms, then you hold the medication, and when you hold the medication, you have to call the physician. Also, sometimes signs that you should hold this medication also might be through the apical pulse rate. If it's less than 60 minutes per beat, then you have to hold the medication, and as soon as you do that, you call the physician before you hold the medication. So how do you administer digoxin? It can be administered orally or IV. So the peak period for both routes is 1 to 4 hours. And then for IV, you have to transfuse over 5 minutes.
Since digoxin is considered to be a high-risk drug, it is important that it is taken responsibly and correct dosage is prescribed. A few examples of adverse drug reactions that digoxin may cause can be anaphylaxis, which is the swelling of the lips, wheezing, or shortness of breath. If the levels of digoxin are too high in the bloodstream, it can also result in severe CNS depression, confusion, and weakness of the body. Incorrect dosage can also result in heart block, abnormal heart arrhythmias, severe abdominal pain and discomfort, as well as electrolyte imbalances in the blood. Since the drug can result in severe toxicity, it is important to monitor blood pressure while taking this medication. If the individual's systolic blood pressure is less than 100, hold the medication and alert the prescribing physician. Prior to administration, it is important to take the apical pulse for 1 full minute to ensure it is safe to administer the drug. Hold the medication if the apical pulse is less than 60. It is also important to monitor an ECG while taking this medication, as it can easily alert the physicians of any abnormal heart arrhythmias. Be sure to also monitor serum potassium levels, as hypokalemia can predispose the individual to digoxin toxicity. If the medication is being delivered via IV, ensure to inspect the IV site, as it can easily become infected and inflamed from extravasation. Although digoxin is a safe medication during pregnancy, ensure that digoxin levels are being monitored in the mom during pregnancy and postpartum, as dosing may need to be adjusted during pregnancy. Be sure to consult your physician before using other over-the-counter medications or natural supplements to ensure that there's no contraindications. Overall, digoxin can be a very toxic drug, and it is important to monitor the individual closely while taking this medication to lower the risk of adverse reactions.